All right. Hello, everybody. Welcome to Monarch Family Chiropractic Tuesday Workshop Night. This is Dr. Kristen Zawada. We are so happy to have all of you here. Hopefully I've got all you admitted and you can hear me and see my screen. We're without some technology in the office today, and we're without the PowerPoint for why we get dizzy. And so Doc's going to recreate that, and we're going to swap weeks. So I hope you find info in hearing about chiropractic facts and things that people believe and are not necessarily true, and things we want to cover that I think most people hear or ask a lot of questions about why these things take place. So let me get rid of my screen there so you can see. Okay, so we're going to cover 5 of the most common asked questions I feel like we get in chiropractic and in the office, and ones that I have heard for many years, and ones that I know our patients get asked when their friends who don't see chiropractors find out they're going to see a chiropractor. And again, I think it's about a lack of knowledge, and we're all about empowering and creating knowledge for our community so that we all can make more informed health decisions. So I think one of the most common questions we get, and that people even ask us when they start care, is once you start going to the chiropractor that you have to go forever, or why do people go forever, or what is that about? And we talk about how I think the profession that has it the most figured out is dentistry, in the sense of we don't go for our teeth cleanings and get a good bill of health from our dentist or our hygienist and then say, oh, well, okay, Haley, you have no cavities today, not too much buildup on the plaque, looks like you're doing your thing, there's no cavities, stop brushing and flossing your teeth, right? They don't ever say that to you, and it seems silly that we would even think they would. And so we think about what the bones in our structure are holding our entire frame and nervous system and spinal cord to do its job for our whole body, for our whole life. And we're really not good at replacing those bones, ligaments, joints, discs at this point. What we were born with, what we have to start with is always what's the most healthy and there to support our body. Foreign parts and pieces cannot do the same job as what we originally, the original parts and pieces, right? So we can replace teeth and different pieces like that when you think about the teeth in our mouth or the bones in our mouth versus the bones in our structure in our body that's supporting our nervous system. So we go and we brush our teeth a couple times a day, and we floss our teeth often, hopefully daily, so that we're avoiding the decay and the degeneration of our teeth. So it's really similar in our structure of our body, right? Our frame that holds our body up. So I'm going to turn my camera a little bit so I can share my screen with those that are with us live. So we want a supported structure, right? We want supportive bones. And as we take care of our spine, we are creating a longevity for our life and our life force, right? For our brain signal down through our spinal cord to have a healthy, clear signal. So taking care of our spine is no different than brushing our teeth every day, flossing our teeth, eating well, having good nutrition, getting movement in our body and exercise, watching what our weight is so that we don't put more stress on our structure and on our organs like our heart and our lungs, right? So it's really no different. So people who understand what taking care of their spine does for their overall health and longevity of their life, as this picture on the left or the middle there is a healthy looking spine. The picture on the right is not a healthy looking spine that doesn't function at its capacity, with a lot of aging and degeneration over time not being either well taken care of or not knowing that a problem existed. So same as looking at those teeth. We obviously all want to have a nice smile, teeth that serve its purpose for, and a lot of gum health has to do with, can relate to cardiovascular health. So it's really important that we take care of our teeth, not just for them to look good and to chew our food and be able to talk and do all the things we use our teeth for, but there's really a lot to our heart health if our teeth and our gums are healthy. So we don't see that there would be a reason we would stop taking care of our spines unless we don't want to use them anymore. and they're really, you're never not using them unless you're no longer living on this planet, living and breathing. So our second question we're going to debunk and talk about is, why do you go if you're not in pain? So we have patients that are wellness patients, lifestyle patients that have been under care for years, and they're not coming in because they're in any pain anymore. But there's a picture that we have in the office and we had in the old office, and I am hoping that it is on my next screen here. Yeah. So this is a component to really talk about pain and what causes pain. And when we look at the nervous system and we look at the spinal cord and each bundle of fibers that are coming off of the left and the right part of the spine, you have that there's three components of it. And so we talk about when the nerve bundle is exiting the spine and going to the parts and pieces of the body, about 40% of it go to your autonomic nerves. That is, your organs, glands, blood vessels, and it serves a function of our body. It helps with our immunity, with literal organ function, breathing, sinuses, allergies, all the digestion, and a lot of our immune system. We also see a lot of inflammation if there's problems in the autonomic nerves, but that's 40% of that signal going out. The other about 40% is your motor nerves. So everything that's running your muscles and tissues that are moving us and holding us up and doing all of the motions, even the motor activity of some of our organ systems. So that leaves only about 20% less for that sensory part of the nervous system. And that is controlling the body to brain communication. So our posture and like where we feel like we are in space, right? Our temperature, hot and cold, and then pain. So pain is a very small piece of the puzzle when it comes to our overall health and our nervous system giving us a signal or telling us a signal. So knowing that when we have compression on a nerve or any kind of interference on the nerve, you many times have to have 50, 60, 70%, 80% pressure on there before you're actually pushing enough on the nerve to be into those sensory fibers to feel pain. We call them the nociceptors, and they are the pain fibers that we only have about 11 to 15% of in our whole nervous system. So it's designed beautifully that way because you don't want to feel everything your body is doing, right? You don't want to feel every part your organ systems are doing with bile and gallbladder and digesting all of your lunch meal and your lungs pushing around, air and your heart pumping blood, the clean blood and the blood we've used, right? Your kidneys doing their function, all of that stuff we don't need to feel as it's doing it. So I think we're very brilliantly designed that there is a lot less pain fibers than there are other fibers of the system. So that when we do have pain, that is indicative of something major is going on and probably has been going on before the pain was there. So we don't really talk about health in this sense in our office and in our health paradigm. Is healthy is pain-free and unhealthy is painful. That's not really how that works. And so people want to stay out of pain and want to keep a healthy nervous system and healthy and vital organs. We don't wait till there's pain, and we don't necessarily need pain in order to know that we're taking care of the other systems of our body. So how about people who've been had spinal surgeries, can't get adjusted? We've had many patients over many years have their doctors and surgeons tell them that they cannot get adjusted, and they should not get adjusted and go to chiropractors because they've had spinal surgery. I've worked with dozens of spinal surgery patients pre and post surgery. And a big reason that we want to work with them is there may be an area that we aren't touching because it has been fused. It no longer moves the way a normal joint should move. And because there's been a surgery or a change in the integrity of the structure, then we need to give more attention to usually the spinal structure and movement of the joints above and below the surgery sites, because those areas are now taking on more stress in order to accommodate and in a sense, work harder for the areas that no longer move. So they are almost, I feel like, better candidates to be getting care in other areas of the body because their body now can't do what it used to be able to do when it could move freely. And sometimes it's not to say that surgeries or those types of things aren't necessary or that they shouldn't happen. In times, that's what needs to happen. And the system then needs support in and around where those surgeries have taken place, especially things like a fusion. So once you are rehabbed through an injury and it is stable and it is in a position where it can have motion, it can have physical therapy, it can have movement, it can have rehabilitation, there is no reason it cannot have chiropractic care and shouldn't have chiropractic care. Okay, next question, or next fact to, in a sense, or myth to bust is hearing the comment, I just have a slipped disc. Discs don't slip. Let's just put it that way. But you'll hear that statement or those terms or those adjectives a lot. Bones misalign, and then it puts stress upon the disc, which then, and the nerves, which then causes the problem. So a disc doesn't necessarily slip in and out. That's just not how the anatomy and how things work. So when we have misalignments, we're creating space to change, and that's putting pressure upon disc and nerves. So chiropractic is very effective when we're getting the right part of the structure moving to support the pressure that has then been put upon the disc. And the last one we're going to cover today is many people that come in here when they're new, especially whether they have kids or not, are always surprised by why you would take your kiddo to a chiropractor. Your kid gets adjusted. You adjust babies when they see the kids running around in here and getting adjusted, or they see the pictures of our kids getting adjusted, or they hear the stories about the little ones coming in there, brand new car seats at, a couple weeks to a couple months old, and thinking they're just there with mom and dad. And then they see them come out of the carrier and get onto the table or onto mom's belly as well. Kiddos thrive with chiropractic. And I'm going to flip the screen, hopefully to, yeah, great. These two pictures. I may be able to move me out of the way so you can read that better. Yeah. So why chiropractic is for kids. The birth process alone can be very traumatic for them, not just mom, when the delivery may be hours to days. The process of how they're coming out of the canal can be a lot of pressure and a lot of strain on their head and necks. Anybody that's been induced has a C-section. A lot of the process in which the babies are delivered these days is pretty traumatic to their spine and their nervous system. They're very pliable, right? They don't have any muscles yet. And so when they are a lot of times being pulled out of the canal, especially trying to get shoulders out, many times the head gets turned about 180 degrees, sometimes more. And that puts a lot of stress on the nervous system. So there can be, from birth to just thinking about if you have kiddos or when you were a kid, what types of things you do, even just that first year of life. They say that there is about 3,000 to 4,000 inputs into the spine by the time a child is 4 years old. So thinking about bumps, falls, learning to walk, crawl, ride bikes, tumbling off their bed, off the changing table, out of the crib, down some stairs, and just before they have reflexes to catch themselves, right? So a lot of kids land on their head or land on their bum a lot when they're babies and learning to develop in those first couple years of life. So it is really an awesome solution to putting gentle input into their system to release the stressors of subluxation that they experience just like we do. Common things that you see with kids isn't necessarily, again, pain. They're not necessarily complaining. It might be the kid that sleeps really poor, is very colicky, has trouble digesting, is very colicky from a lot of gas or air bubbles or issues with digestion and being able to go to the bathroom regularly. It can become something more upper respiratory or upper sinus. When the atlas for C1 or C2 are subluxated, which is very common for kids. because of all the things I just explained, that you can see things like colic, reflux, again, constipation, ear sinus infections, constantly the kid that's sick and always getting the runny nose, snotty nose. We can also really see it as they start developing in their attention, in their ability to focus and their ability to pay attention to something or stay focused on something. So we see a lot of those sensory disorders or that kind of ADHD type behavior, if you will. So the benefits really for something so gentle. Now they receive adjustments that are like a tap of a finger. That is how light their adjustments are. They don't have muscles and ligaments that have developed for years and decades like we do. They don't have a lot of input into their structure yet that has had patterns of months to decades to develop. So their adjustments are super small, super light. In fact, sometimes we're adjusting and you don't even realize that we're adjusting because they don't need the movement that an adult frame does. And they respond beautifully and almost instantaneously. So kids' adjustments, things change with them usually very quickly when we're addressing all the right components. So it is a very great way to give them very healthy ways to thrive in especially those first handful of years. But it can really improve that their behavior, their mood, because kids can't, and especially babies, their way of telling us something's wrong is usually through acting out or have their body having a symptom and not being able to respond because the immune system is weaker, and or just not necessarily being able to focus or put their attention where you think they at one point could and couldn't. It affects their sleep and it just affects their overall ability to thrive. So the perfect storm sheet on the other side of the page there is what we see when traumas happen and how things can build. So warning signs you can see isn't necessarily pain. There's other issues that they experience that we shouldn't wait and look for pain from them. That's usually not what you're going to see. But between, traumatic things with birth, accidents, or even just a stressful pregnancy, all those things, or toxins they're around in the home, pre-birth, that mom's breathing in, medications that mom is taking or that they're taking, all deposit different chemicals into their body that their bodies are not equipped to process yet. So as their immune system and digestive system and all those systems are developing, they need as much immune support as possible. And that is something that we deliver through the chiropractic adjustment. So hopefully that gives you some ideas of why we adjust, who we adjust, and people that you may know in our community that have those concerns or issues and aren't getting adjusted. Know that those are things that you can hopefully arm yourself with some knowledge to let them know, hey, I just learned that this is why these people can get adjusted, or this is why this could be helpful for you, even though people may think that it's not for them. So I am going to open up as best as I can my screen and the volume if anyone has questions and wants to chat. And otherwise, I want to thank you all for joining us tonight, and I'm going to pause the recording.